My name is Katie Brumfield, and I'm the manager of career services at the Colorado School of Public Health. And today I'm speaking with Emily Holcomb. Emily graduated from our school in 2022 with their Master's of Public Health in Population Mental Health and Wellbeing. Hi, Emily.
Hi, thanks for having me.
Yeah, thanks for joining us and for volunteering to share your career path with us. Could we start off by just tell us your current job title and where you work?
Sure. I am the Waiver Implementation Specialist at Healthcare Policy and Financing.
Perfect. And what do you do on a day-to-day basis, or I know that sometimes day-to-day can vary, especially in public health careers, but essentially what do you do on day-to-day, or if there's bigger projects you work on, however it makes sense.
Yeah, I've been with Healthcare Policy and Financing since August 2022, and I was hired to work on a mobile crisis response benefit. That was funded by the American Rescue Plan Act, and we met our major milestone this summer, which was launching an enhanced benefit to provide mobile crisis services to people in behavioral health crisis across Colorado. And so this last month, I moved into a new position working on a waiver project, focusing on continuous coverage for a variety of populations. So yeah.
Very cool. So is it kind of like managing that big project on a day-to-day basis?
Yeah, I typically spend a few hours a day in meetings. There's a lot of meetings because this work is very collaborative and detailed. In general, I'm working on planning. My role is guiding this through submission and implementation for the next couple of years. I am working on a lot of deliverable development. It is a legislatively mandated waiver submission. So I'm working under Senate Bill 23-1300.
Wow.
And there's all sorts of requirements for that. And part of it is conducting a feasibility study of covering these benefits. And the other part is actually writing and submitting a waiver demonstration application to our National Centers for Medicare and Medicaid.
Wow. What would you say are like the top 3 skills you use the most?
Sure. I think the first one is collaboration, just the skill in being able to work on a team. And then that goes hand in hand with project management skills, project planning, just really having a strong attention to detail. And then a lot around community engagement, whether you are doing it or you are supporting it to happen. A lot of what the department focuses on is ensuring we have transparency in our benefit and our benefit development process for the state of Colorado. So having skills in written and verbal communication and an understanding of working with different stakeholder communities is critical to this job.
Yeah. Wow. Did you have any idea that this is where your career would end up when you started out? Yeah.
Not exactly. I think that a lot of what I enjoyed from my previous career work in facilitation and leadership development was understanding policy and learning how to create change at a population level, which is something that my concentration really supported. And I wanted to get involved in policy work, but I did not know it would be through Medicaid. I didn't really even fully understand that was an option. So no, I didn't quite expect this, and I'm really glad to be in this role.
That's very cool. Very, very cool. When you were a student, what classes really helped prepare you, or what things did you learn that really helped prepare you for this job?
Yeah, I think that I'm really benefiting from classes that focused on research methods as well as program management, project design. So even if it's not submitting a research plan somewhere or a grant proposal, I'm really using the skills of generating a hypothesis, research question, being able to research and find data that I can then translate for many different audiences, especially for leadership level audiences, being able to communicate effectively and clearly about both what information they need to know on the topic and how we're going to get there is really important. So I'd say those are some of the top classes. And then this is working in a system,
Yeah.
both statewide and national. So I think a lot of my work is informed by theory, understanding social determinants of health. That's a big movement in this work rather than sticking to just medical understanding of health, but how does our place and experience impact our health? And then just kind of broadly understanding how change is made. Any other kind of social related theories are very helpful. So yeah, a broad understanding of public health has been very supportive, and I think it's a niche in this work that a lot of times people are experienced in providing direct service, but public health is a really supportive skill that complements those firsthand experiences.
Yeah, that's good. I like the way you explain that, because sometimes people are like, what is public
Mhm.
health?
Yeah, it makes sense of those firsthand experiences. I think being able to put those those skills really in the context of a greater experience and how to translate them into policy that actually reflects the people we're serving and how to get those services done.
Yeah, that's amazing. So far in your career, what has been the most rewarding?
It was a really rewarding experience to launch a benefit within a year of starting at HICBUF. Um, we were able to collaborate with another state agency. The role was making sure that the service, which always existed in Colorado and was billable, but through a variety of means, was standardized as far as, again, billing. HICPUF is a payer, so that's a major focus, but also the standard of service. So with the Behavioral Health Administration, we work together based off of federal guidance, state guidance, as well as gathering a ton of best practices information from national research, but also firsthand experiences by providers and members in Colorado to create a new service definition, which has now been codified in our Medicaid state plan and also the Behavioral Health Administration set of rules and regulations. So yeah, I started in August, and July 1st is when all of our Medicaid rules launched, and it became a fully operational benefit under some new set of regulations that I won't get into, but if anyone has questions, I can send you so much information on how it works.
That's amazing. And now this is going to help so many people.
Yeah, it does feel really rewarding to
Yeah.
hopefully support members experiencing crisis,
Yep.
anyone in Colorado experiencing crisis, but also the people providing these services, since they can know what to expect as far as what they should provide, and also people doing the billing, what is expected of them. And I hope that they will be able to, make a little bit more money by being able to provide these services and get their, income.
I love that. I got my master's in mental health counseling, so I'm very familiar with the reimbursement.
Yeah, it's a really big challenge. And again, that's something I didn't know would be a huge part of my work and something so critical to policies in Colorado, but understanding what providers are going through, and kind of being able to support streamlining that, making it make a lot more sense, will ultimately help them provide more services to Medicaid members. A lot of times providers opt out or
Mhm.
bill a state general fund instead of being able to bill Medicaid, because it is a really difficult process occasionally. And they may feel like they're not being paid as much, which is another part of our innovation. So Yeah, it's
Awesome.
hopefully going to expand the service to members.
Yeah, I love it. I love it. On the flip side, what challenges have you come across in this career path?
Plenty, as one would expect.
Of
Um,
course.
yeah, I think that for me, I've always valued collaboration, which is such a buzzword, but I think it's a really important skill and it comes with a lot of other skills and it's a value as well. So I think that there have been barriers in understanding kind of what each other's values are. In
Mm,
my role as a subject matter expert, I provide information, I facilitate, but there are other folks involved in the process who have a lot more expertise or kind of authority on these issues. And so being able to communicate with those different audiences is really important. And also just emphasizing that this is a collaboration, it's new territory. I think that, yeah, some of the biggest challenges were in that it's mobile crisis in specific is a difficult issue.
mm,
It's sort of understood that we need crisis services, but how we get there can vary across a very diverse state.
yeah.
And working within the executive branch is really interesting because we work a lot with the governor's office and other state agencies. And they don't always have the same missions or have different rules that kind of govern them. And we did a lot of work with other state agencies that I hadn't done before. And ultimately, I learned so much about communication, how to work with people, being reactive or responsive. So I
Mm.
think the challenges I had were around those soft skills.
Oh,
And I think that that's one thing I would emphasize as something that will help people in their career, having developed those skills a little bit.
you just have to do them more often, to kind of get better at them. Yeah, I guess.
Yeah, and there is so much detail to policy in the Medicaid world and really anywhere, whether you are acting as a provider, there's just so much to understand. And so it's even important to have those soft skills behind understanding the technical side of things, working with a team that calculates rates using very complex methodologies. I don't have those skills, but being able to understand each other is
Yeah.
critical to this work.
Yeah, absolutely. Yeah. Yeah, I wouldn't have no idea. Okay, last question. What advice do you have for anyone that's watching that might want to do work that you're doing?
Yeah, I think understanding your values is very important. And I think those are, as I've mentioned, in some of the relationship building side of things. How do you want to lead? I think leading through those skills is really important in this work. A lot of people have technical skills. So um, showing up as your authentic self, I think, is really valued. And um, also just going for it. I didn't know that I would be here. There are so many different projects happening, and until you jump in, you really have no idea the opportunities, especially in this Medicaid world. I think in the state government in general, there are just so many things happening with innovation, um, going from a medical model to a social determinant of health, health related social needs kind of model. Um, yeah, I think leaning into that side of public health, regardless of your interest area, is going to serve you well.
Great advice. Well, thank you so much for sharing your career path and what you do for the state of Colorado. It's amazing work. Thank you so much. And I can't wait to see where your career goes.
Yes, thank you.
Right.